When nature falters, we take over. Here is Prashanth Fertility Research Center and Prashanth Multi-Speciality Hospitals offering you the best in reproductive health care. Hello viewers, the joy of motherhood is the ultimate experience in a woman's life. We at Prashanth Fertility Research Center make your baby dreams come true. We have a multidisciplinary team which offers the ultimate and the best in reproductive health care. Our innovative technologies and surgical techniques gives pregnancy rates which are unsurpassed. Excuse me.
Good morning.
I have an appointment with Dr. Geeta Haipriya. Okay. Thank you.
Thank you.
Hello, doctor. Good morning. Come in. Doctor, I'm Ramya. He's my
Hello,
husband.
ma'am.
And this is our report.
Okay.
We got married 4 years back and we still don't have a baby.
So these are all your previous tests?
Yes, doctor.
Let me have a quick look at it and I'll tell you exactly what to do. Okay, Ramya. The reports show that both of you have problems. You have a problem with the ovaries. You have small water cysts in the ovaries, which are called polycystic ovaries. And you also have a tumor in the uterus called a fibroid, a fairly big one.
Doctor, is it the initial stage of cancer?
No. There's no cancer involved, but it can disturb your chances of getting pregnant. And we don't know about the shape of the uterus. We have to do an X-ray to know that. And Santosh, you also have a little bit of a big problem. The sperm count is very low and the movement is also slow. And there are a lot of abnormal sperms.
Is that a major problem?
It is a problem, but I'm sure with the high technology that we have, we will be able to solve it for you. The motto of this unit is to give a baby or a couple of babies to everybody who walks through, and I'm sure I'll be able to do it for you. So I'll write a few tests for you. You do the test and get back to me with the report. Then we'll analyze and see exactly what we have to do. Okay?
Thank you, doctor.
I'll see you in a couple of days.
Thank you,
Thanks,
doctor.
Hello, doctor.
Hello.
So these are the results. As you said, we've done all the tests and we want to know the results. So please, can you just tell what is the next step for us?
So after looking at the reports, Ramya, I already expressed you had two problems. One is the polycystic ovary and the other is the fibroid. Now another problem has been identified in the X-ray of the uterus, and that is in the shape of the uterus. It's called a septate uterus, which means that the uterus is almost divided into two halves. So we have to correct the shape and bring it back to normal so that your chances of pregnancy get better and the chances of miscarriage becomes less.
Doctor, there are a lot of problems then. How can I...
Not to get worried, okay? There's only a single procedure to solve this problem, and that is called a hysteroscopy and a laparoscopy. It's a single procedure. Hysteroscopy is looking inside the uterus, correcting the shape and making it normal. Through the laparoscope, we make a small cut below the umbilicus, put in the laparoscope, and we check the uterus, tubes and ovaries. We can, through that small hole and a couple of holes on either side, we'll be able to remove the fibroids, however big it is. And we'll also be able to treat the polycystic ovary through this. Once this is done, your chances are very, very good. Okay? So don't get worried. We are now in the operating theatre. We are going to do a laparoscopy and a hysteroscopy. Hysteroscopy is looking inside the uterus through the mouth of the uterus and visualizing the uterine cavity to check what problems there are. We know from the hysterosalpingogram that there is a septum, and we are going to resect the septum through the hysteroscope. We move from one ostium to the other ostium, correcting the septum, or rather cutting the septum and creating a normal uterine cavity. We also look for other problems in the uterus like polyps and fibroids, which can also be corrected through the hysteroscope. This would mean that we are doing a hysteroscopic polypectomy and a hysteroscopic myomectomy. Now, if you continue to look at the video, it will show you that the septum is completely resected and the shape of the uterus has now been restored to normal. We are now looking through the laparoscope into the inside of the abdomen. Laparoscopy is a technique where a small cut is made below the umbilicus, 2 tiny holes on either side, and through the 3 holes we look inside the abdomen and check what is wrong with the uterus, tubes, ovaries and the other structures in the abdomen. We are now seeing a myoma screw going into the fibroid. The fibroid is now separated from the muscle of the uterus. The cut is made bigger and you see the fibroid being delivered slowly out of the muscle of the uterus. We now look at the base of the fibroid being removed in toto from the muscle of the uterus. The blood vessels which are bleeding are now dealt with by coagulation, which means that you are controlling the bleeding by using current. The next step is suturing, which means that you place sutures in the muscle of the uterus. This is done very meticulously because we want the uterus to get back its normal shape and strength, because this uterus has to deliver a baby later. The suturing is now complete and the uterus is now back to normal. What we are looking at now is removing the fibroid out of the abdominal cavity. The morcellator is a wonderful instrument which does this job by breaking the fibroid into small bits and delivering it outside the abdominal cavity. We're now looking at the last bit of the fibroid coming out, and the fibroid is now totally delivered.
What about my problem, doctor?
I had spoken to you about the problem with the very low count, the movement and the structure of the sperm. The computerized analysis has now identified another problem with the sperm DNA integrity. We now look at a computer-assisted semen analysis. The scientist has now put a drop of semen under the microscope. The sperm class analyzer now takes over and starts analyzing the semen for count, structure and motility. You now look at a lot of moving sperms under the microscope. The sperm class analyzer now looks at the count and the motility, and these two are now represented in the report as the count and the movement of the sperm. We are now looking at the computer, selecting the sperms one after the other, and after an adequate number of sperms have been selected, the computer now starts analyzing the structure of the sperm. The morphology is studied in detail, and after studying all the sperms in the field, it gives the result as percentage of normal and abnormal sperms. The computer now starts analyzing the DNA sperm integrity, which is very, very important because it gives us a good idea about the capacity of the sperm to produce a pregnancy. DNA is the basic structure of any cell, and if it is defective, it's very, very important and we don't get good results. So you definitely need a test your baby technique. We call it ICSI, and ICSI is injecting the sperm into the egg, and we have to apply another higher technology for you, which is called the IMSI. And in IMSI, we actually select the best sperm. It is a computer magnified image which magnifies it 30,000 times. And we look at it and select the best sperm. Because the sperm which is defective won't give a good pregnancy, so we choose the best sperm and we inject the sperm into the egg after selecting the best sperm. By this, we increase pregnancy rates and we also decrease miscarriage rates, because when a baby is conceived with an abnormal sperm, miscarriages are much more. So it decreases miscarriage rates, and by doing this technique, your carry home baby rate, which means that, the baby which you can take home, the rate is much, much better. So your chances of pregnancy and the chance of taking a baby home is much better with all these techniques.
So how long does it take, and what's the next step, doctor?
Yes, yeah. Now the next step is, now we have planned. We know exactly what you need. Next is you have to come for the counseling session, where we will tell you what you need and when to come, how long it will take and what it costs, and the success rates, which are about 55 to 60% as applied to your case.
So we went through your website last week and we went through all the details. So we are very much happy about this. So we would like to do the next step.
Yes, no problem. So, don't get worried. You do have problems, but I'm sure we'll be able to do it. And like I told you, our motto is to give a baby to everybody who walks through this unit. So the same applies to you. So you just relax, leave it to us, and we'll give you the baby. We are now walking into the most important part of Prashanth Fertility Research Center, the IVF lab. We are now looking at the process of egg collection. The patient has been prepared with hormones so that she has something like 10 to 12 follicles. A follicle is a fluid-filled space with the egg inside. We are now looking at the ultrasound monitor, and you see the needle going inside the follicle. Now, follicle after follicle, the needle enters. You see the follicle getting empty as the fluid gets sucked into the needle. One after the other, the follicles are entered into, and the fluid is sucked and handed over to the IVF lab. Meanwhile, the husband produces the semen sample. The sperm is prepared and kept inside the centrifuge so that it is kept ready. You are now looking at the follicular fluid being placed inside the test tube warmer. The scientist now hands over the follicular fluid to her colleague, who is now sitting in the humidicrib. The humidicrib is exclusive equipment which actually creates an atmosphere which is similar to that seen in the fallopian tube, maintaining the same temperature, the humidity, and the gas concentrations. The eggs are now studied under the humidicrib and identified, and you now see the doctor placing the eggs in culture media inside the incubator. What we are looking at now is called an ICSI microscope. An ICSI microscope is a very high definition microscope where you look at the sperms, you look at the eggs, you inject the sperm into the egg, you look at the embryos through this microscope. We are now looking at the technique of sperm capturing. The new ICSI technique means that you are selecting structurally normal sperms. Some men have a high percentage of abnormal sperms, and we want to select the best to give the best results. The ICSI is intracytoplasmic morphologically selected sperm injection. It's a new computer-assisted technique to identify morphologically normal sperms. The sperms are viewed at a magnification of 6000 by digital image processing and image enhancements. The defects in sperm heads, shapes, size, and abnormalities associated with DNA fragmentation are identified. You now see several sperms being studied. With ICSI, the implantation and pregnancy rates are significantly higher. And most important of all, ICSI decreases miscarriage rates because you are selecting best sperms to fertilize the egg, thereby creating normal babies. We are now looking at the technique of intracytoplasmic sperm injection. You see the sperms loaded inside the needle. The needle is now piercing the membrane of the egg and going into the cytoplasm, which is the substance inside the egg. The sperms are now injected into the cytoplasm of the oocyte, and you now see the needle coming out of the egg. We are now looking at the embryo the next day. The day 1 embryo you see with 2 pronuclei, the day 2 embryo with 2 cells, the day 3 embryo with 8 cells, the day 4 embryo with a cluster of cells, the day 5 embryo is called a blastocyst. You also see a hatching blastocyst there, where the embryo is actually coming out of the shell, and this helps implanting into the lining of the womb. You're now seeing the laser-assisted hatching, where the laser is actually shot on to the shell of the egg, and this helps the embryo to come out and to implant onto the endometrium, which is the lining of the uterus. You're now looking at the diode laser, which has helped in improving pregnancy rates. You're seeing the laser beam shooting on to the zona, and this thins out the zona so that the embryo is now able to come out easily and to implant onto the endometrium. This is particularly useful in the older women and those with repeated pregnancy failures. You're now looking at a scientist loading the embryos onto the catheter. The best embryos are selected for transferring into the uterus. She now carries the catheter towards the gynecologist, who will now put the embryos into the uterine cavity. The lining is all there, triple line, excellent lining, ready to receive the embryos. We are now looking at the computerized freezing machine. What do we do with our excess embryos? We have to freeze them for use during a subsequent cycle. Now, the computerized freezing unit is one of the best equipments in our armamentarium because it has greatly improved our pregnancy rates, and with our frozen embryo transfers, we get pregnancy rates which are equal to fresh transfers. The freezing unit is loaded with straws which are coded and labeled, and once the mechanism of freezing is over and the program set is all complete, the embryos are taken and loaded on to the embryo tank. The embryo tank is maintained every 3 to 4 days, where the liquid nitrogen levels are checked and checks out there to make sure that the systems are in place. This is a cryologic freezer which we use to freeze sperms. At Prashanth Fertility, we have a backup sample for every patient. There are some men who cannot produce a sample on that day, and this is very useful for that sort of situation. Wonderful! The patient is pregnant with twins. You see the pictures of a 6-week pregnancy and 9 weeks pregnancy. The babies have now grown. They are 32 weeks. And you see the 2 lovely babies here. Look at the wonderful smile on their faces. Isn't it worth all the effort? Lady has now come to deliver her babies. Here is the heartbeat of the babies being monitored. She delivered by cesarean section. Good morning, Ramya.
Good morning, doctor.
A big congrats to you.
Thank you.
You have 2 babies, a girl and a boy.
Wow.
This is your girl.
Oh. She resembles you a lot, huh?
And here's your lovely boy. A lovely family.
How sweet. I'm so happy. This is the best day in my life. Hey, look here.
Thanks for all the support. Thank you.